Hi, my name is Kathryn Blankenship, and I am on faculty at Middle Tennessee State University. And today I'm going to be presenting on communication strategies and working with individuals with limited or nonverbal language skills. I have been a speech language pathologist for the past 16 years, and I've worked with a wide range of individuals with varying communication abilities from verbal to completely nonverbal. And I've also volunteered at a therapeutic course writing here in Tennessee called Saddle Up. So it's kind of combining two of my passions that I have is working with individuals with communication disorders and also horses. So I'm really excited about presenting on this topic today for y'all. So let's get started. So first, I want us to think about what communication is, because all of our individuals that we work with most likely will communicate very different ways. And so whenever I ask an individual, what do you think communication is? Most people initially just say, well, when you talk. But if we think about it, communication is a lot of different things. It's body language, it's gestures that we use, it's also the words that we use. So I like to tell people and help people think about communication on a much broader scale. And this is extremely important when we're working with individuals with limited or no verbal communication, because we have to rely on recognizing the way that they communicate to help interact and communicate with them better whenever we're working with them. So communication really is this large umbrella term, and all of these things fall underneath communication. The way we speak, the gestures that we use, eye blinks, head turns, any type of physical gesture like a hand wave. All of these things are what encompass communication. So specifically, we use language for us to communicate. And most of us use spoken language to communicate. Some of us might use a gesture visual like American Sign Language. You might work with some individuals who use some type of device or pictures as far as communication. That's going to be all tied to language. Language is the means that we use to express our thoughts, our feelings, how we understand stuff. And so language is a part of communication. So we're just going to talk just a minute about just the different types of communication, because I think it's important for us to understand what they are. So the first one is receptive language. Receptive language is the language that we understand. So it's how well someone understands whatever is being spoken to them or is being expressed to them, whether you're showing your client pictures or you're modeling something for them. So it's how well, so in this situation, like if you're asking a child something, so this says, red car on your ear. So we would know the child understood this if the child did the action. That's a sense of letting us know that the person understands what the communication is being expressed. On the other side of that is going to be expressive language. And this is what we use to actually express our thoughts, our ideas, and our feelings. So this is then, for most of us, this is spoken language. But like I said, if you're using a visual or a gestural communication, then you might use American Sign Language, you might use your pictures, you might have a iPad that you use that has a communication program on it, or another device that is specifically for individuals that use it for their communication. So expressive language can look in different ways too. It can be written, it could be pictures, it could also be gestures that you use. So I want you to all think about, how does communication look like with the individuals that you work with? Because I'm pretty sure it probably looks different across the different clients that you work with, depending on what their diagnosis is or what their disability looks like. So does your client use some type of device? And we're going to talk about that here in just a minute. Does your child use gestures? Is your child able to do some vocalizations? And, even if the individual's not able to produce actual words, but are able to make vocalizations. Sometimes those vocalizations can be meaningful if they use consistent types of vocalizations for stuff. You know, do they use pictures? Are they able to point? Do they point to things? How do you know your client is communicating? So first thing, whenever I'm talking with individuals and helping them recognize different types of communication, I ask them to make an inventory or think about all the different ways that your client or your clients or the individuals that you're working with communicate, because it can look very different. So I'm pretty sure a lot of the individuals who are nonverbal or who have limited verbal abilities, a lot of them might use an augmentative or alternative communication device, which we often call an AAC device. It's just a term, it's really, the AAC is an umbrella term, and it really encompasses a lot of different modalities that an individual can use. And if you think about it on a daily basis, we probably use a lot of alternative and augmentative communication devices aside from spoken language, because we might write letters or text messages or emails or send someone a picture to get a message across. And so an AAC device can look very different across very different individuals depending on what their needs are, what their abilities are with using the different devices. It includes an AAC device is used or is developed to help an individual be able to share and express their ideas, their feelings, and to talk with and interact with people within their environment. And so we're going to talk a little bit about, we're not going to talk in great length about the different types of augmentative and alternative communication devices that are out there, because there's a lot. We're just going to touch on a couple. So there's a wide range of individuals who might use an AAC device that you might have encountered or that you might encounter. So some individuals with autism might use an alternative device to communicate. An individual maybe with cerebral palsy, or an individual with intellectual disabilities, or you might have an individual that's had some type of brain injury, maybe from a car accident, like a traumatic brain injury, or maybe you've had a stroke. These are all individuals that could potentially benefit or might use an alternative augmentative communication system. So we have different types of alternative augmentative devices. So the first one is what we call an unaided system. And this is where the individual is going to use their own body to communicate. So this is where an individual might use a point or a gesture. I had worked with an individual that was nonverbal, and she had pretty significant cerebral palsy and was wheelchair bound and had limited motion or movement of her arms and legs. And when she was excited or had a yes response to something, she would consistently raise her hand. And so that was one of the ways that she was able to communicate. She also did a lot of eye gazing. So she would look, if I gave her choices between two things, she would look at the thing that she wanted. So she did an eye preference. That's one way of that would be an unaided type of system that you can use. So having a child point, having them, if they're not able to point, having them look at something. Those are some ways that are some types of unaided systems. So it could be this, it could be a sound such as a laughing if they're happy, or a groaning or grunting if they are upset or if they're uncomfortable. It could also encompass body contact, like a handshake or a high five. Their eye movement, like I said, as far as tracking an object or attending or looking at the desired object that they want. Facial expressions, so smiling or frowning. Hand movements such as waving or thumbs up. Head movements such as nodding, yes or no. Posturing, so sometimes maybe how they're sitting could be a way for you to know if maybe they're uncomfortable, or if they're wiggling, maybe they might need to use the restroom, or something's uncomfortable on them. Those might be ways that they can communicate with you. Okay, so we also then have these aided systems, and these are probably more familiar types of systems that you would probably encounter and have seen probably more on like the broader market of different types of devices. So we have two different types. We have low tech and we have high tech types of devices. So the basic or the low tech items are just really things that you can kind of make on your own. So they could be pictures, they can be like actual objects. So like having the objects of like your brushes out for the individual to make choices between the hoof pick or combs or something like that. Those can be used as low tech. You might have photographs. So there's different types of software that you can get to help you make different types of like pictures. It's called Board Maker, and you can make different pages or sentence strips using pictures. I personally prefer, with a lot of the clients that I work with, using actual photographs of things because I think it's more relevant and salient to them to actually use the actual physical picture of what they're going to have, because it can help make the connection, especially if you're working with a client that has who is nonverbal and also might have some cognitive deficits to go along with it. It's really helpful to make stuff as concrete for them as possible, so they don't have to guess at what you're trying to ask of them or what you want them to do. Writing for the individuals that are able to use written word or reading, communication boards. So here's an example of something. This is made out of that program called Board Maker. And so these are like the choices that the individual might have. Like they might have the choice of like cleaning the horseshoe or brushing or patting the horse, or helping put on the saddle, the choices of, where do they want to ride, inside or outside. And I've used this with clients where you can take something like this, you can laminate it. What's nice with this program is that you can easily save these templates and go in and change the pictures and stuff like that. Also, it's always good to have down here at somewhere, always ask them how they feel, if they're, if they're excited, if they're bored, if they're tired. So that's just an example of a low-tech AAC device that you could possibly use. Some of the higher tech devices are going to be more the ones that are going to be more expensive. And some of them can actually require quite a bit of training on how to use. So a Dynavox, this device is specifically just an AAC device, and it is used and programmed most likely by the speech language pathologist or a special educator along with the parent. Oftentimes parents are very savvy about how to program their devices for their individual. iPad has come out with, iPad has the ability to have a program called Prolo Q2 on it that kind of works like a Dynavox, where you can make different boards. So you could have a board set up for just you're grooming your horse, and then you could have a board set up for activities that they want to do. And then you could also have more of like a computer type of device. The first two are pretty portable, so the kid would use it. I'm not 100% sure how much in a horse riding environment they would be used within that. I've seen some other types of devices that I guess you would consider as high tech because they're battery operated, but they're on the lower end tech, like the Big Macs, where it's just one button that they can push, and they have them in smaller sizes where you can program them to say, walk on or stop if they're wanting the horse to go or to stop, or, I'm finished, or I want to keep riding. You can have those types of devices too, because these are really expensive devices. So I definitely would talk with the families to see about if they would allow their child to use this. And also, I don't know how feasible it would be to have it, but you could definitely, I foresee using something like this maybe in the grooming aspect or the getting ready of the therapy session or of the writing lesson with the individual. So we might want to think about how could we determine ways to communicate with your individual. So if this is a new client or a new student that you're working with, you definitely want to make sure that you talk with the family or the caregiver. And these are just some sample questions. I'm sure that there's probably a lot more questions that you could probably ask and that you probably will ask. You always want to find out how do they communicate? And if they communicate using an AAC device, what does it look like? So do they use pictures or do they use an iPad? And I also would ask if this is the only type of communication method that they would use, because some individuals can use a multiple types. So maybe at school they might use a Dynavox, but they also might use like a schedule or picture board that isn't tied to the Dynavox, that looks more like one of the low tech where they have pictures on it. And so if they're familiar with both of them, or if they're familiar with more than one option, that might give you more flexibility within your writing lesson as ways to communicate with your client. So you also want to talk to them about other ways they might communicate. Or ways that the individual might communicate when they're upset or they're hurt or they're sad. That's always important for you to know, because you want to make sure that if there is something that is going, that the child isn't liking or doesn't hurt, because sometimes, when a child is upset or in pain, they may not always, cry or do something obvious as far as recognizing or letting the person know when they're like that. So making sure that you talk with the family to know all the different ways that they communicate, especially, you want to know if they're feeling okay, if they're not feeling okay. You definitely want to get those out. How do they let you know if they need to use the restroom? Those are all types of things that you'd probably want to have. If the child does use a high-tech device, you might want to ask the family or the caregiver if they would be willing to let you, if they're able to use that device during their writing lesson. And, if so, then you also want to be able to help you or train you on how to be able to use it or how to make a page on it, so that you're able to utilize that during your writing lesson with them, so that they are able to communicate more. After you've talked with the family, if you have the ability to talk with other like teachers or therapists or individuals that have worked with the person, I highly recommend that too. Individuals might communicate differently across different settings, so they might be really, really good at communicating or using a certain type of device with their parents or with a teacher, or, vice versa. And the teacher might find, I really find that, the pictures are much more effective, than using the high-tech device. So I would talk with them. So you would ask them some of the same questions. So what type of method do you use with the individual? If they use any other alternative types of devices or additional devices, and then what ways do they communicate with you? So like recognizing in this. So when you're working with an individual that is nonverbal or has limited verbal abilities, sometimes it takes a while to learn their communication style. So it might take time. I mean, you can get this information from the family. So that's why it's so important for you to talk to the individual, to talk to the individual's family members or therapists, to make sure that you can get a good inventory of ways that they can communicate, so that whenever you're working with them, you can be effective in what you're doing and they can have an enjoyable lesson. And also so that if there are signs of discomfort or pain and stuff like that, so that you can address that during your lesson with them. And then finally, you always want to be able to observe them. You want to see how they're communicating. So are they able to point? Are they able to manipulate their hands? You might work with a client that has limited hand mobility. So pointing might not necessarily be a good option for them, as far as, wanting them to point, okay, do you want to brush your horse or do you want to, clean the hooves? You might require, they might be better at eye gazing and looking at what they want. If they use any gestures, so they might have some gestures that they use them. it could possibly be some, some signs that they might use, or it could be, like the client that I talked about who raised her hand for her yes, no. Well, that's not necessarily a conventional sign, but it was her way of communicating. When she wanted something, she would raise her hands for her yes response. And so that would be a type of gesture that she used to communicate that she wanted something. You also want to note, does your individual make good eye contact, and are they able to attend? And this is particularly important because if you're trying to give them instructions or you're trying to make sure that they understand what's going on, you want to make sure that the individual is looking at you so that you have their attention, because if you don't have their attention, the likelihood that they're going to understand or attend to what you're saying is not very high. So you always want to make sure that the individual is able to make eye contact, that they're able to attend to what you're saying. You most likely, most of the clients that you or the students that you're going to work with are probably going to come with some type of alternative and augmentative device. But like I said, asking the question earlier, do they use multiple types of things? Because, it might be more effective, or it might be easier for you to have pictures to use with an individual, like I said, versus carrying an iPad around. And so that's another question that you would want to maybe ask if they're able to use another device. Then you want to see how they respond to if you use a gesture to them. So like if you tell them to stop, are they able to respond back to those gestures? And then also, because I'm in a horse riding lesson, there's probably many times that using a gesture or something like that is an effective way for you to express to the student what you want them to do. So you want to make sure that not only maybe do they use gestures, but are they able to understand gestures that you might want to use, or at least you can teach them to be able to understand the gestures that you want them to use. Also, you want to see, are they responsive to using pictures or objects? You might have an individual that is really consistent at responding when you have the physical objects here, but taking them to the picture form sometimes is a little bit more abstract for them, and it's harder for them to transition over to using the pictures as far as making choices. So you want to assess, okay, is this an individual where we are going to want to have our objects out to help them make choices, or are we going to be able to utilize some pictures? If you use pictures, are you able, do you have to use real pictures, like take pictures with a camera of this object, or are you able to use like the board maker, which is more of just like 2D type pictures of drawings of it, because some individuals will respond differently. I had one client where even on their, we used the iPad with him. I had to take pictures of everything, or go onto Google Image and find actual pictures of everything, because if it was like a drawing type thing, it was too abstract for him to be able to make the connection of that picture to the object or the referent that it was referring back to. So really being mindful of the type of visual stimuli that you're using, because most often an individual who's using an AAC device is going to be relying a lot on that visual representation of the item to help them understand what you're asking of them or what you're wanting them to do. So that's just something for you to think about. Okay, so how do we evaluate? So you're probably thinking, okay, I have this client, or I have this new student who has limited or has no verbal ability. How am I going to know what, how do I know when they're understanding stuff? How am I going to communicate with them? So these are the three areas that I would most likely, that you're going to want to assess with them. because these are what's going to be important for them following and participating in the horse riding lesson with you. So when we think about vocabulary, you want to, and you might have to teach them, and you might have to, because this is probably going to be unfamiliar vocabulary for them, especially if they are a new rider and they've not been around horses. So you want to think about the specific activity, the specific vocabulary that you're going to use for your lesson or for multiple lessons. So like barn, horse, parts of the horse, like the mane, the tail, the hoof, different types of equipment they're going to use, like the grooming equipment, their a halter or reins that you might want to have, whichever, the saddle or blankets, you want to have all of that vocabulary. And one of the things that I think is very beneficial for using with your clients might be making a book for them to take home so that their family can help review and help them learn these different types of terminology. So what you might do is take pictures, of your courier brush or your hoof pick or your comb and the bridle and the saddle, and maybe even a picture of the horse that they're going to ride. Maybe a picture of, I often also find if you can get a picture with the individual actually brushing the horse and getting a picture, with the brush and having them learn the vocabulary that way. Because a lot of times individuals like to see themselves in the actual pictures, and it's very motivating for them to want to look through the book and to learn the vocabulary. So if they don't understand the vocabulary, then it's going to be really hard for them to do these next two things, following directions and answering questions. Because if they don't know the words that you're talking about, it's going to be really hard for you to assess why they're not following your direction. So definitely identify what vocabulary you're going to be using in your lessons with your student. Some suggestions as far as helping them learn it is making, experience books or making vocabulary books for them by taking pictures of things. Or if they have an iPad, you can ask the parent, can you take pictures and make almost like a storyboard for them and if they have Prolo Q2 on their iPad, they're probably likely you're going to be able to make like a storyboard or an album of pictures. You can also do that with like their Dynavoxes too. Now with like technology and cell phones, you could probably easily do something like that, at least so then the parents could go home and maybe print it off and have something like that. Because vocabulary is really important. Like I said, if they don't know the words, then it's going to be really hard for them to understand anything additional that you want them to do. So the next area that you're going to want to assess is them following directions. Because within a horse riding lessons, you're going to want them to do things for you. So there's definitely a hierarchy of going from simple types of questions to more complex types of questions. But like I said, they have to know the vocabulary first, because if this first one is get the brush, if they don't know what a brush is, then they're not going to be able to follow that direction. So, once you've established that they have an understanding of the vocabulary, then you can start having them follow simple directions, such as get the brush, onto something more advanced, such as walk to the end of the arena and take a left. And so you can see they go from simple types of directions where you're maybe just adding a couple descriptor words to it, or you're adding, put the blanket on the horse, or you're maybe giving them almost a two-step direction, such as brush your horse and put the blanket on. So recognizing the types of questions that you're asking. So if you want them to have like a specific brush, like get the purple brush, because maybe the purple brush is easier for them to hold, or maybe it's easier, it does a better job of brushing the horse. And if your client's not responding to it, well, it might be, you've taught them the word brush, it could maybe be that they don't know the word purple. And so being aware of the vocabulary within your following directions, and also the level of the type of question that you're asking. I would probably err on the side of having your directions be as simple as possible. just to facilitate them being able to follow through with it and having the success of doing it, and probably reduce your frustration of having to repeat it. So the last area is getting them to answer questions, because you want them to know that you want to see if they understand what you're asking of them. So you have simple questions. So simple questions start with what or where or who, to more complex or abstract questions such as how and why, where you're kind of talking about more processing. So if you have an individual that is nonverbal and is also has cognitive deficits, you probably want to keep to the more concrete, simple questions about the here and the now. Maybe it will probably be more challenging to ask more abstract questions. So like, what do we use to brush the horse with? Or where is the brush? Or who is brushing the horse? Are very concrete questions that they can answer in the here and now. When we brush the horse, those are, and how do you brush the horse and why do we brush the horse, are more complex language-wise for them to understand, to be able to understand the question, and for them to be able to tell you back. Just because an individual is nonverbal doesn't necessarily mean that they have cognitive deficits. There's many individuals that have to use alternative and augmented devices that are, Stephen Hawking, who just passed away. He used an augmentative and alternative device, and he did not lack in intelligence. So I don't want you to think just because an individual is using an alternative and augmentative device that they don't have the cognitive capabilities of being able to learn the vocabulary, being able to follow simple or more complex directions, or being able to answer questions. You want to give them this opportunity to be able to do this and engaging within the therapy, within the lesson, because you want them to be an active participant in it. So you're thinking, okay, now I have the areas of kind of where to assess. What do I do when they don't respond or they don't communicate back to you? So this is where we're going to talk about strategies to help whenever communication breaks down. So we have different types of, as a speech language pathologist, we call them tools in our toolbox that we use to help our clients understand stuff. And we call them cues or prompts to help them be able to be successful in completing whatever task or answering whatever question that we want them to do. So the first, we're going to talk about some different types of verbal cues. So the first one is repeating. So the instructor says, hold up your reins. So the child doesn't respond. So and we're going to talk about these cues in kind of a hierarchical manner. So this is probably going to be the first level of type of cueing you're going to do, is you're going to give a verbal cue, and you're probably going to repeat it the exact same way if a client doesn't respond. So if you say, hold up your reins, and the child does not respond, then you are most likely going to repeat it, hold up your reins. So one could argue, well, why didn't they hear it the first time? It could be if they're not attending. So that's why in your observation with the child, you want to make sure that they're able to attend and make eye contact, because you don't ever want to give a command or try to teach an individual something when you don't have their full attention. So before you give a direction, you want to make sure, like, hi, Lucy, or listen, hold up your reins. Before you actually give the command, you want to make sure that you have their attention. But they still might not respond. And some individuals need multiple prompts or multiple exposures to what you want them to do to be able to process maybe the language that you're asking them to do. Or it could also be that maybe vocabulary wise, maybe they don't know what reins are and they're not 100% sure what you want them to do. So this goes again back to why it's so important to make sure that you're teaching the vocabulary that you want them to know for the lesson that you're working on. So if if you've repeated and they still don't get it, so you might want to rephrase it. So maybe you say, I want you to squeeze your legs around the horse. and the student doesn't respond. So you might want to rephrase it, and maybe you've repeated it again and the child or the student still doesn't respond. So you'd probably want to think about rephrasing it, and most likely when you rephrase it, you're probably going to simplify it to, I want you to push your legs. Okay, or I want you to push your legs in, versus I want you to squeeze your legs around the horse. So rephrasing it might help them in understanding what you want them to do. So one of the things for you as an instructor is you're going to have to be really cognizant of the type of language and the level of language that you're using with your client. And so it might take, a month's worth of lessons with your client to really understand what level they're at, what they understand, and what type of language that you can use with your client. The next type of cue is simplifying a command for them. So maybe you've repeated it, maybe you've rephrased it. So I want you to squeeze your legs around the horse. And maybe you said, I want you to squeeze your legs in, and maybe they're still not responding. And so you maybe would use a verbal cue, say, squeeze your legs. And so you're just going to make it as simple as possible, the type of command. And you might go straight from giving the command and them not doing it, and you might know your client well enough to go straight to, okay, they're not doing it, I'm going to go to a very simple command for them. So verbal cues are cues that we use a lot, and a lot of times we naturally will repeat stuff when we see an individual not understanding or not following through with something. These are just different ways that you can modify the verbal response that might help your client better understand if they're not getting what you want them to do initially. So next we're going to talk about visual cues. I'm a very gestural person, so I actually naturally use a lot of visual cues. And actually in therapy, I have to be very cognizant that I use my hands a lot, because if I'm trying to really assess if a child understands something and I'm pointing at a whole bunch of stuff for them to, that I'm asking them to do, and they could be utilizing just those visual cues. So visual cues are, I think a lot of people naturally use a lot of visual cues, which are good. I think it's helpful. Pointing is probably the most common thing, like get the brush over there, which is a very natural, great prompt to be able to use to help the client. So you might say, get the brush. Maybe they don't do it. And so you might repeat it with the pointing prompt, like get the brush, and let them, hopefully they can gaze follow and follow your point to actually getting the brush. But people probably naturally use, I know I use a lot of pointing whenever I'm talking. So that's a type of visual cue that you can use. You can also, if you are trying to reduce the amount of pointing that you're doing, sometimes you can say, get the brush, and maybe the child doesn't respond. And maybe you look at it and you say, get the brush, and you give that visual gaze to that brush. That's obviously going to be an individual that is paying attention and looking and is able to pick up on that more subtle type of cue. The next one is gestures that you might want to use with the visual cues. So if you have a child and they are, they're riding and they have their horse, and you want them to hold up their reins. Okay, so what you might do if they're on the back and they have their reins down and you want them to hold them up, you want them to hold them up higher, you might say, raise your reins, or, hold up your reins, and you might do that gesture with it for them to hold up. Or if you're wanting them to tell their horse to stop, you might, do the hand gesture stop. And there might be other gestures that you might use pretty routinely within your lesson with your individual. But gestures are also a really good way to help support a verbal message. Or you might just use a visual cue on its own to tell someone, like if you're in a lesson and you're working with a student and you want them to stop, and you don't want it to be as overt as a verbal cue, because a verbal cue is a pretty higher level type of cueing, and you want something more subtle, you might just give a visual cue for them to stop. So the next type of visual cue is using pictures or symbols. So you might have a picture for them to brush the horse, of them actually brushing the horse, that you might help reiterate. Like if you tell them to brush the horse, you might have them show the picture, brush your horse, and then go and get the brush to brush the horse. Or you might have like a picture board where they're able to pick out different types of things that they might want to use. If you have a client who's able to read, sometimes having stuff written out for them is very helpful. So you might have specific words that you might use, like stop, go, or if you have someone, like I said, who's able to read, you might have the steps out, because your goal for your rider is might be for them to be more independent in maybe grooming their horse or getting their horse ready. And so you might have their steps written out, like, first brush your horse, then put the blanket on the horse, second, lead the horse to the mounting block, fourth, get on the horse. So you might be able to have some type of written visual cues for them to help, instead of, having to always give them the verbal cues and promoting them to be more independent and doing stuff. You might use visual cues. So the last type of cueing we're going to talk about is probably the most maximally type of cues you can provide someone, are tactile and physical cues. So this is more hands-on. So the first one is hand under hand. So this is where you are physically manipulating or helping the client to do something. So you might, if coming back to the reins, if you have a client or you have a student who is you're wanting them to lift up their reins, and so maybe you've asked them, and what you would physically do is you would come under, they would have their hands on the reins, or however you want to have them hold it, and you would come up underneath physically and help them, giving them that physical, that tactile cue of lifting their hand up. You also, a lot of times you might maybe use like a tap on the leg, or something like that you can use as a physical cue to tell them, you can maybe to hold their reins up, or to tell their horse to stop. A lot of individuals might need this type of cueing. The thing with having it, you don't want to, when you're providing this type of support to them or type of cues, you don't want to take and go over and manipulate and move their hand like that. First of all, that's kind of invasive as far as like just grabbing someone's hand and doing it. And second of all, you really want them to kind of be in control, and you're just providing support for them. So going underneath it, and that's why it's called hand under hand, is you're guiding them and helping them achieve the activity. And hopefully you'll be able to fade that. So maybe instead of you having to do that, maybe just a light touch or something might be all eventually that they need, because you would hope that by using these different types of cues that you might have to start off with like a tactile cue like this, but then maybe after, several months, several lessons, depending on the client, you might just be able to then go to a visual cue of them to just lift their, you might go, okay, raise your reins, versus having to physically go over there and touch them. So your goal is to hopefully to get your rider to be more independent in doing stuff. You always want to be respectful of your rider, especially if you're having to use some type of physical or tactile cue with them. You might have clients who are tactilely defensive, who don't want to be touched or who do not like to be touched. And so these types of cueing methods are probably not going to be effective types of cues for that specific client. Or you just might have to be very vocal, like, okay, I'm going to show you, like telling them and giving them notice or warning that you're actually going to be touching them. Because some individuals don't like to be touched. So like I said, the touching, you could do the light tap on the leg. You could do, a tap on the shoulder. I often, sometimes getting clients' attention, they often need a tactile cue, like me just saying their name, like Lucy. Sometimes that's not enough. And so sometimes, a light tap on the shoulder or a light tap on the leg for them to make sure you're gaining that attention. Or if you're giving an instruction, so maybe touching them, giving them that tactile cue to help bring their attention back to you is something that you can also use. The final one is going to be manipulating your objects or modeling. So, you can physically manipulate your objects to provide tactile cues for them. So tying knots in rope so that they have those knots right there as a tactile cue for them, so that they know how to use their reins. Actually physically modeling what you want to do with them. So if I was, working with a client maybe, or an individual, and I want them to, hold up their reins or pull back on their reins, I might have a set of reins where I'm going to model for them how I want them to do it. Okay, we're going to hold up our reins, or we're going to pull our reins back, or we're going to pull our reins down. You might physically do that, or you might physically model for them how to mount their horses, or how to sit on their horses, or how to put their tack on, where you're physically going to show them how to do something. So these are the types of strategies that you can use. So you can use verbal cues with them. You can use visual cues. You can use tactile cues. And depending on the student that you're working with, you might be using all of these types of cues with them. And you might find with some students that you work with, some are going to be more effective than others. You should hopefully, the goal is hopefully over time, you should hopefully be able to use less of these types of cues with them, because they're going to be getting more familiar with the routine of riding a horse. They're familiar with the routine of what you're expecting from them. So hopefully you won't have to be using all of them all the time. All right, so ways to increase communication within your therapy session or within your writing lesson with your student. Giving choices, I think, is such a great way for promoting communication. So like I said in the beginning, having the child or having the student, do you want to, I guess maybe this would probably be, you want to comb the mane, or do you want to brush the body? Giving them these two choices, so they have to either express by pointing, by eyes gazing, using their picture, using their iPad or whatever. That's giving them the option and letting them feel like they have some control over what they're doing. Trying to ask a variety of questions throughout the lesson that you have with them. Again, you have to be aware of the level of types of questions you can ask your student, but, recapping what you just did. Like if they got done brushing their horse, asking them, what did we just do? We brushed our horse. Or, if after you brush the horse, you're holding the blanket, asking them, what do we put on the horse's back? And having that, there and letting them answer the question, we put the blanket on the back, or them pointing to the blanket, or however they're going to communicate that with you. Sometimes switching the role, letting the child tell you what to do. So maybe the first time you ask them, do you want to comb the mane or do you want to brush the body? Then maybe the next time you can allow the student to give you the choice of what do they want you to do. Maybe they want you to use, the curry brush or hoof pick, and maybe they hand these out and give you the choice. This just allows them the opportunity, another way for them to be engaged and involved within the lesson with you, and gives them the opportunity to also be able to communicate too. I think this is important, talking about what you're doing when you're doing it with the child. So if you are brushing with your student and they're brush with them, beside them, like, oh, I'm brushing, their withers, or I'm brushing their back, or, I'm going to brush their mane. Look how pretty their mane is. It's long and soft. Let's touch the mane. Giving them that helps them learn the vocabulary that you're working on. It helps them connect it. If you can add as many modalities in the learning, verbally saying it, visually them seeing it, tactily doing it, that's going to help them learn it much, much quicker. Use of schedule boards or choice boards, that is really important thing that you can use, as far as if you have a kid that has a little bit of trouble transitioning from one activity to another. So if you have a student that really enjoys the grooming process, or really enjoys the riding and doesn't want to get off the horse. Using a schedule board as far as, first we have to groom the horse, then we get to ride, then, after that we have to clean, our brush, or maybe after you get done riding with the horse, maybe they get to give, let the horse graze for a minute, or they get to give the horse a bit of hay, or they get to pet the horse, or whatever it is, so they can visually see that, and that can help transition them through. And a lot of times whenever I volunteered in the past, that might be something easy, small. You can keep it on a strip of paper. I usually try to laminate them. You can have them Velcro on the back. You can keep it in the back of your pocket, so when you're done with something, you can rip it off. It's a good visualization for them to see, okay, it's done with that. This is the next thing that we're doing. It can help keep the writing lesson on task. So that is something I use a lot as far as helping, especially individuals who are nonverbal and have limited cognitive abilities. This is a great way to really help them understand what's going on in the lesson. That you can use. Okay, just some things that I think that you should to remember whenever you're working with your student is every child is different. What works for one child is not necessarily going to work for another student that you have. Remember, you can use more than one of these strategies at a time. You can use more than one type of augmentative device at a time. That's why you want to make sure, if they use some type of high-tech device, are they able to also understand a lower-tech device such as pictures, or using one of those mini-Mac type buttons things that you can program to say something. Don't be afraid to try out different things. So like if you get thinking like, I think this is really going to work, maybe there's a different type of, strategy as far as maybe a tactile cue or a visual cue or different types of pictures. Don't be afraid to explore different things, because you might find out one that really works for the student that you're working with. Collaborate. Make sure that you're talking with parents to see what works at home and what's working here, so that you don't necessarily have to reinvent the wheel, that you can piggyback or you can carry over stuff that they're using at home or in other settings, so that it can also be effective in the lesson with you. And you're part of a team. So if there's other people that you work with that might have another client that's similar, find out what they're doing with their student. Find out if, what works with them, or what types of strategies they're using. Talking with, like I said, if you have access to other teachers or other therapists and stuff like that, that's a great way to really find out more information about the individual that you're working with, and for them to also you to give them insight. You might have things that they didn't see, or they might have things that you didn't see. And it can be a really, really informative process. And it's a great way to really learn more about different treatment techniques or different strategies to use with your student. But those are just some key points to remember. And hopefully y'all have some questions about all of this. But I want to thank you for listening, and hopefully this information is something that y'all are going to be able to utilize within your horseback riding lessons with your students. So I'll open it up to questions now.
Hello, everyone. I'm so thankful that everyone is here. Hopefully y'all can all hear me. But I'm going to answer the first question from Shannon, and she is asking, can you share where you get the picture graph template with the horse examples? Actually, that is from a program called BoardMaker. I'm going to write it down here at the bottom so everyone can see that. It's called BoardMaker software, and it's actually a little expensive. It is it starts at $399. So if you're a smaller program, it might not necessarily be something that y'all might be able to purchase. What I've used when I did like home health and stuff like that, and I didn't necessarily have the money to buy something like that on my own, is that I would often use clip art or go to Google Images, and you can easily make a I guess it didn't go. I guess I have to enter it. There we go. You can easily use those types of pictures and make like your own like little choice board and something like that. Like if you don't have access to the actual like board maker program. I tried to Google to see if there was any similar types of programs that were cheaper online, and I wasn't super successful in finding. It took me to a Pinterest page that showed a bunch of other types of boards, but you might be able to Google those types of things and see if maybe some of them will pop up and some of them might be something that you could use. So hopefully that answered your question. The next question is from Sandra, and she asked, could you share programs you recommend for iPads that is cost effective for a small program? There are two programs, well, one in particular that I'm pretty familiar with that I've used. It's called, and again, I'm going to type it here real quick at the bottom so that y'all can have it. It's called ProloQ 2 Go. Sorry. Trying to type and talk at the same time, multitasking is kind of hard. That is one of the programs that is kind of like, I don't know how much experience you've ever had with using these types of devices. Dynavox is a device that is specifically made for alternative augmentative communication, and those devices are pretty pricey. But other app people have come out with programs that are similar to it, and ProloQ 2 is very similar to like something that you would see like on a Dynavox. It is... Oh, it's saying that you can't see what I'm typing. I feel like I'm in the discussion board with everyone. I'm not exactly sure how to make that happen. Maybe someone will help me with that. And I can also find out and get the information to y'all. So the ProloQ 2 is $249.99. It's a great program, but they also have the Tobii Dynavox Compass. And so if you were to type in on your iPad, go to the App Store and type in either one of these, you would be able to get these up on your, the Tobii Dynavox one I'm not familiar with, but I'm pretty sure it's probably going to be pretty similar to ProloQ 2 because it's made by Dynavox. So it's probably going to look very much similar to that. And that one actually is $129.99. So I feel like that one's pretty reasonable. I'm not 100% sure how user-friendly it is because I haven't used it. But if it's like the Dynavox, I'm assuming it's pretty user-friendly. And that one definitely is a lot more cost-effective than the ProloQ 2. So those are two programs that I would recommend you exploring. I know that going back to the BoardMaker one real quick, I know that you can download a free trial for like 30 days. So if you have, students that you have in mind that you want to use, or you just want to make a whole bunch of templates or pictures, that might be a great way for you to just download it for like the 30-day trial period and get as many pictures as you can. Again, I want you to be conscious and use, because some clients like I've worked with, or some students that you might work with, they might do better with actual pictures of things than, because the ones on the BoardMaker and the ones that you're going to see on the Tobii Dynavox Campus and the ProloQ 2 are going to be more of like 2D type of pictures. You do have the options on both of those to actually put in real photos of stuff. So that's another nice feature of that too, is that you have, and I have not heard of LAMP for iPad, but I'm going to look that up because I'm always in for looking up new stuff also. So let's see. The next question that we have
Kathryn,
is from Becky.
actually, can I interrupt you? I'm so sorry. We're okay. A little bit over on time here, so we need to keep moving. I really apologize.
Okay, that's okay. I'm sorry. So,
is there any other thoughts you'd like to share with the audience before we move on?
I don't think so. Can I respond to these people individually or no? Or like?
We can have them sent to you, and then then you'll be able to respond.
I just don't want I just didn't want their answers. But thank you so much for listening, and hopefully everyone saw that it was something that they can use.